My name is Erin. I am with the Pennsylvania MGMA. Peter just popped away for a second. And we have Carol Thompson here. And Brenda, I see Brenda is also on the call. Carol, do you want to introduce yourself?
Yes, Carol Thompson. I am practice administrator for a 10-physician orthopedic practice, and we are part of a larger group, although not a health system, but a physician and larger group, Premier Orthopedics, with about 18 different divisions, and I'm responsible for one of those divisions.
Great. Brenda, I'm not sure if do you have audio? Oh, there's Patty. Patty, we were just doing some introductions. Would you like to introduce yourself? Oh, hold on. I think you're muted. Let me unmute you. Okay, go ahead. I cannot hear you yet, Patty. It looks, oh, try again.
Okay, can you hear me now?
Yep, you're good.
All right.
I'm back. Sorry about that. Thank you, Erin.
That's okay. Patty was just going to introduce herself.
Okay.
Okay, my name is Patty Kessler. I'm the practice manager for Partners in Family Care. We are a small family practice on the western side of the state, right outside Pittsburgh.
Great, thank you. And Brenda, did you want to introduce yourself? Peter, did you want to introduce yourself?
Sure. So I am Peter Constantino. I'm the executive director for Pennsylvania MGMA.
Do you want to start off the conversation?
Absolutely. Thank you, Erin. I appreciate it. You know, they say if it's going to happen, it's going to happen. And we have an ambulance and a fire truck out front for a neighbor's home. My daughter's like, there's a fire truck out front. And last time she said that, I was in Denver and the house next to us was actually had a fire. So,
Yeah.
So everybody, welcome to the Pennsylvania MGMA Leader to Leader Forum. I appreciate you being on the call. I know many practices are in the midst of ramping back up and seeing patients. The forum, and I think all of you have been on this before, is open for any topic, any discussion. But I did want to at least come prepared with 3 issues that we've been hearing, my team and I have been hearing is very prevalent right now. And some practices more, some specialties more so than others. The first is about the visitor policy. How many, whether a visitor is allowed back in the exam room with the patient or just one person there. And sometimes the visitors feel left out. That was very prevalent in an OBGYN practice, where the visitor policy stated that only the patient can go in the back. And so the spouses could not go back when they were doing the sonogram. Etc., and what the reaction to that policy was. Is anyone facing, albeit whether it's OBGYN specialty or not, but is anyone facing any, not resistance, that's too harsh of a word, but any feedback, negative feedback coming from patients about a visitor policy? Do you have a visitor policy, or are you not following any type of guidelines for the number of visitors that should be in an exam room or a visit with the physician?
Well, I can speak for family practice. We do have a visitor policy. We've had to make it a little bit fluent because we have an elderly population. So although we are saying only the patient we want in the waiting room and in the exam room, a lot of our patients require assistance. So we are allowing one visitor to go with an elderly patient. We have not had any complaints about it. I think people are very understanding about it, but we've also been pretty good with explaining the policies while we're making the appointments. So there's no surprises for people when they do come in.
Is there anyone else who has a visitor policy, and how are patients and their families accepting it?
This is Carol. We have an orthopedic practice, so we do have a policy that patient only unless they're a minor or they have difficulty ambulating. So we do have, we're only allowing the patient in except those 2 circumstances. Occasionally we get a little bit of pushback, and if the patient or the guest is really insistent, we subject the guest to the same screening that we do for patients. We take their temperature, we ask them the questions, and then we allow them to go back. We really haven't had anybody unreasonable about it.
Okay. And Brenda, are you able to unmute and? Yeah, go ahead. It looks like you're unmuted. All right, we can't hear you, Brenda.
Looks like maybe your computer microphone itself is off, Brenda. If you want to tinker with that. Or you can try using the chat box too.
Right. All right, Brenda, we'll let you tinker with it. Hopefully you can unmute and use your laptop computer, or you can dial in by phone if you'd like and participate that way. The second thing that I had, and we can always come back. So Brenda, if you come back on, I'll be more than happy to get that question over to you. We had another issue is people are asking about how to collect copays for telehealth visits, and there are a number of practices that have conducted the telehealth, but they're seeing a decent receivable in copays because it's hard. They say it's hard to collect them. So, is anyone having any issues with collecting copays for telehealth visits? And if not, how are you doing so well in collecting them?
In collecting, well, I can be totally honest. First of all, we haven't had, right at the very beginning of the pandemic, we did have a lot of telehealth, but we're having less and less now. I think, and again, I think it depends on where your practice is located. Because we are outside of Pittsburgh, we never were a hot spot. We had some cases and people were putting everything into place, but I think most of our patients were fairly comfortable still coming in for face-to-face. We never closed our office. We continued to see patients who wanted to be seen by the doctors. So that being said, we had less telehealth than I think a lot of other practices that I have been, communicating with. And we haven't actually even addressed the copays because most of the insurance companies were covering the copay amounts, like the Highmark plans in our area covered the copays. So we really haven't had a collection issue as far as copays go.
And Patty, a follow-up question before I let others address that. Since you didn't shut down, did you see a decrease in patient volume though during
Absolutely. Yes, absolutely. We, in fact, I just finished my May numbers, and I would say we were down about 50%.
Okay.
So,
yep.
I mean, inpatient visits.
Right.
Yeah.
Carol?
Yes, we had a lot of telehealth. Now, we're about 15 miles southeast of Philadelphia. And like Patty, we saw a lot of telehealth in the beginning, and it started to taper. So I asked our phone reps to ask when patients were less willing to agree to a telehealth visit. And because it's an orthopedic practice, a lot of our patients are older, and they saw it as an appropriate reason to leave their houses and to get out.
Right.
So we have, every week, we're seeing fewer and fewer telehealth visits. The way that we collected the copay, just when the visit was scheduled, we asked for debit credit card to cover the copay since they wouldn't be coming in. And we really didn't have any trouble. People were thankful to be able to get the care they needed without having to come in. So we were very lucky that way.
Carol, can I ask a question? So when you collected that copay, after you submitted it to insurance, did you find that insurance covered the copay and now you have to refund?
We weren't
collecting if we knew for sure that the insurance company was waiving copays during that time. We were
I
keeping
see.
our phone reps current on that information. But for Medicare, where we knew there was going to be a 20% or something, we were collecting that up front.
Okay, okay.
We did not close our offices. We did stagger hours a little bit. We kept kind of that pod of physician to medical support staff so that we were not taking people, our staff or our physicians from office to office. We have 5 office locations, so they were assigned to an office, and that's where they were for 8 weeks. There was no traveling, so that if we did have a positive employee or physician, we weren't contaminating the entire practice.
Right,
contained
we did
location.
something very similar to that. We had,
And we spread out the visits.
yeah. So we had people work from home. Actually, all of our billing, our receptionists that were making callbacks to patients, they were all making those calls from home. Most of our clerical people were able to work at home. And then I just staggered staff, like for the medical assistants and for our front desk. We staggered them. They worked a week and then they worked from home a week if they could. If not, then they were off for that week. And then, but everybody's back now. I mean, as of June 1st, everybody is back in the office, and, you know, it seems like we're back up and running, and the schedules are, I would say, probably about 75% right now.
And
We
Brenda,
furloughed some staff.
oh, go ahead, Carol, I'm sorry.
We furloughed, I guess, about 25% of our staff for 6 weeks, and about another 25 to 35% we reduced our hours but kept them working. We also have, as you said, Patty, anyone who's not patient-facing has been working from home, and we have a really good phone system, usually, and it's, yeah, and I said that because last week we had no phones for a day, and it's internet-based, so our phone reps are able to work from home, so even they're working remotely, so we did move as much staff as we could off-site.
Right. How many staff do you have?
68.
Oh, you're a big player.
Okay.
Yeah. There's only 17 of us, and that's including our 4 physicians. So,
And Brenda indicated that they did not do telehealth for anesthesia, although her doctors did do a few FaceTimes for some pre-OB. And she's at, for those of you who don't know, she's at St. Luke's in Allentown. So she does not have any particular copay issues that for her practice.
right.
So that's pretty interesting there. I guess as we're ramping up, my question is this: the CDC guidelines, require that we do temperature checks or recommend that we do temperature checks. And there are a number of people on both sides of the aisle to doing that. So I'm curious, and Carol, I'll start with you, especially with a large practice, 68 people. Are you doing temperature checks, or are you doing symptom screening, or neither?
Okay, so for the patients, we're screening them when they call to make the appointment. We screen them again when they arrive at the front desk, and they are taken to a separate area where we take their temperature and ask them those questions again by one of our MAs or athletic trainers. So they're asked those questions 3 times. The staff is required, there's someone assigned at each location every day. The staff is to have their temperature taken as soon as they walk in the door, and they're asked, are you experiencing any symptoms? And their temperature is recorded every day, physicians included.
Patty, how about your practice?
We are doing temperature checks on the staff every morning, including the physicians. But again, we're fairly small. We are not screening our staff every day, asking, particular questions, because I mean, I think that we had this, and we have weekly staff meetings. It is implied that if you arrive for work, you are symptom free. And I mean, the doctors have been very clear on that. If there was ever any, hey, even if you've got something, what they had told the staff was, even if you have something like tickle in your throat, that's a call to the doctor in the morning. Because we're family practice, this is the stuff these guys deal with. So we don't ask the questions. We do take the temperatures. We are not logging them anywhere. We are just checking them every day. We do have a couple of people who have conditions where their temperatures, because of inflammation problems that they have a high temperature. And some days it's normal, some days it's high. However, that's a physician call. We check every patient that comes in. We are checking those temperatures. And we do tell them, I mean, that's just part of a regular visit. So, I mean, everybody that comes in gets their temperature checked, no matter what they're coming in for. So we do that all the time.
And in doing temperature checks, whether you're recording them or not, is there any hesitation on a part of the staff to have you take their temperature?
No, not for us. Nobody's been, I think that everybody just understands, and it's kind of, this is what we have to do. So we just do it.
Carol?
Mm-hmm. Yeah, we're not having any problem, Peter, and I think that they take a certain comfort, not in having their own temperature taken, but knowing that all of their coworkers are being checked.
Yes.
Right. Okay.
Yeah.
And Brenda, I know you have access to the chat and not necessarily to voice communication.
No?
Oh, yes, we can hear you.
Oh, okay. Yeah, well, again, being in anesthesia and being in the OR, the hospital mandates all of that. But it's just interesting because I'm on the other side of the spectrum right now because I have a colonoscopy next week. So yesterday I had to go to one of those drive-up tents to get tested for COVID. So that was an interesting experience. And I'll see what how it's done for our department and for the hospital next week.
Does the hospital require temperature checks of staff as they come in for work for their shift?
I'm not 100% sure what they do over there. I'm in my billing office, which is across the street in our own building. We're still working one person a day in-house.
Okay.
And our physicians bought a lot of PPE for our staff. So we have all the extra supply in our office. So we have everything there. And each day when you work your day in the office, one person each day, they clean the office behind them, just wiping the general spots they touch. And I increased my housekeeping services to the billing office. Was monthly, now it's weekly. I have everything in the office set for anyone that needs to use it for whenever. I did buy one of those no-touch temperature checks. That's in our office.
Okay.
But I believe next week or the week after, I have to check my email. I'm implementing 2 people in the office per day. And again, we're billing different than up in the OR with most of my staff are. But we'll be doing 2 people in the office and the rest are working from home. But it's been working. I fought working from home for my staff for many years. And it's funny how when you're forced into it, you're forced to rethink it.
And Brenda, what do you think is the timeline, if you have one currently, for your staff to come back to work and work from your place of business? Or do you think
In the
you
billing
do a
office.
combination?
Yeah, in the billing office, we're going to go to 2 people in the office per day next week. And I think I'm going to stay there. I have no interest of moving that for a long time. I know my husband's in pharmaceutical, my daughter's in digital media, and I know other people, and my other daughter works for Vanguard. They're already stated that they're working from home for the rest of the year, period. So I just feel that as long as people can prove to me they're actually doing what they're doing, for the most part, getting the job done,
Mhm.
I will continue this path of 2 people per day. And that's what that means is everybody comes in twice a week. And 3 days are working from home. As long as that's not being abused and I'm watching the AR like a hawk, I may continue forever allowing it 1 day a week. It's funny how it forces you to relook things. But I'm not in a hurry to get the whole staff back in the office. There's 8 of us, and it's a nice big house. We're all spread out. We're all in our own room, but we are sharing a bathroom, etc. And if there's not necessary, I'm being open-minded about it, as long as we're there to address all my doctors and nurses' issues over in the OR as they need it.
Brenda,
So
can I
having
ask
2
a
people in the
question?
office does that. Mm-hmm.
Does your staff want to come back, or are you getting any pushback about them they don't want to come back for, health reasons?
For the most part, it's right, and nobody's pushing to come back. No.
Okay.
I have one person that's refusing to come back until there's a vaccine because she's high risk. So I'm trying to figure her out. I had 2 of them say, "Oh, this is wonderful. I can do this forever." And I'm thinking, no, it's not going to turn into work from home forever. So that's the fine line I'm toting. That's why I thought maybe I'd go to allowing it 1 day a week, but no, there's no place like the upfront and present to do your job. So that hopefully that answered your question.
Yeah.
Is anyone, oh, go ahead, Patty, please.
No, my mind just, like I think about all of this stuff, because I think when we had people working from home, there were things that I noticed that worked well, and then things that I thought communication was difficult. So either we were sending emails back and forth to each other, or there was texting, on the mobile phone. And I thought that was definitely a deterrent from working at home, because I thought, it's easy right here when you can just ask somebody, questions about things. But I found that when they were home, it was more difficult. So that I didn't care for. But other than that, I always thought that, if you couldn't see them, you weren't sure that they were, doing what they were supposed to be doing, and, how much productivity. And I know productivity is not going to be the same as when they're in the office, because it just isn't, because I think there's a lot of distractions when you're at home. However, I do believe that they were very happy about having the opportunity to not be exposed. So I think that was they did appreciate that, most of our staff. I had some people who had no issues one way or another. You want me to work from home? Fine. If not, I can come in. I don't care. So
Right.
I don't know. I wonder about this, and I know that there's a big push to, if you can work from home, do so. But I think it kind of depends on the actual employee or the staff member, because I don't think it's for everybody.
I would agree that with our team, and we're a team of 5, early on, I think the team met and had a vote that they wanted to go back to the office. So I jokingly said, "Oh, that's really nice that you missed me." And they laughed that one off. It's like, no, we said go back to the office, And it's because of what you said. You do miss that ability to just turn around and say, "Hey, what do you think of this idea?" or what have you. Whereas we have used a lot of Microsoft Teams, and we've been using that for our video team meetings and for a lot of conversation back and forth. And that's been helpful, because initially we thought, oh, if an email came in into this client's account, we have to email it to Peter. So we email it to Peter, like that. And it was just easier to, after a while, there's the house, there's the phone, there's a text messaging, there's Teams, there's email. And it's like, where do I look? Like, so let's keep it all in one place. And we have used Microsoft Office Teams quite a bit for both the video and I'll call it text messaging. And we, you know, if I want to talk to Erin directly, I have a chat set up for Erin. If it's the entire team, I have it set up for the entire team. I like it. It has worked because there's fewer platforms I have to look at for messaging. You know, email is just going to be what's coming external to our organization and coming into it. The Teams has been primarily our team. Anybody that needs to communicate with one another, that's what we've done. So that's been very helpful, but we do miss the ability to just, as I said, turn around or just say, hey, Patty, how's your day going today? You know, you want that in between, you know, you got a little lull between a patient and maybe you want to just say, hey, how's your day going? And you can't do that.
Right. Yeah. I like I said, I mean, I always worked and came into the office through this whole thing. I was here every day. And I just felt like, you know, I find if I'm at home, I can't, I don't know. I don't feel that I was nearly as productive if I would be at home because well, part of my job is to manage the office and I can't really do that if I can't see you and hear from you. And
right.
You know, but that was just my style. So I don't know. It's funny because I've talked with a lot of people in a lot of different industries, and there was a fellow that I talked to, and he was in charge of it's Citizens Bank, getting everybody their customer service platform to work from home, and we're talking about 800 people. So he made that transition and he got them from home, and he said, you would be surprised at the productivity of that call center. It basically dropped when they were working from home. It came back up a little bit because at first they just were kind of like, yeah, I don't know what to do.
Yeah, right.
So, yeah, and I mean, and so I'm listening to different people from different industries, and I think, you know, there's pros and cons to it. Some people do really well with it. I think it depends on the person. If you are a motivated person and can keep focused, I think it works well.
Agree.
Yeah.
Brenda, any of those considerations coming into play too? I know you said, you know, you're opening up to 2 people, but as you look long-term, do you see, you know, that the issue is going to basically be, you know, productivity, whether it continues, you know, a part in the office and part remote?
Well, like I said, I would consider doing 1 day a week at home, and a little bit of selfishness on my part. I like going into the office because then when I go home, I unplug a little bit more. Where this route, I'm 24/7 because everybody's working different days, different times, and so it's a lot more on me. So I do like going into the office so I can, because then they know I'm there. They know the hours that I'm set there, and they don't normally call me at home unless it's necessary, where now it's like a free-for-all. So I do miss the unplugging.
Yeah, I agree.
That is an important piece. So we're not essential. My company is not essential, and the team has been working from home since March 17th. And then when the governor gave the order, it was on Monday, March 23rd, then I was the last one to leave the office and shut it down. We have not been back since. Now the governor has opened up, since then he has opened up into stage 2, early stage 2, but the county executive in May extended the stage 1 lockdown through the end of June. However, on May 29th, or early May, he extended it through the middle of July. And then on May 29th, he indicated that we're entering stage 1. And that's also because our county we actually had some increases in COVID, not just test positives, but hospitalizations. Not by much, but we did. And then, so on May 29th, he indicated that we're entering stage 1. The following week, Tuesday or Wednesday of that week, the governor indicated that we're entering stage 2. The county executive, 2 days after that, which is 4 days since he entered stage 1, issued a decree that we're going into stage 2. And so we're sitting here wondering, wait a minute, you extended the lockdown, first of all, 45 days. You then opened up stage 1 on May 29th. And then 4 days later, you're entering stage 2. Like, there's no consistency, with the mindset. I would rather have someone say, look, we need to err on the side of caution. I'm extending it 45 days. We're entering, stage 1, May 29th, and stage 2, you may not enter until June 29th or June 30th. I would understand that. I may not agree with it, but I would understand it. But how we went 4 days later from entering stage 1 to entering stage 2 for an county executive that extended the original 45 days, I don't know. I know it's a political, you're damned if you do and you're damned if you don't, but I would rather respect somebody, even if I don't agree with them, because they're consistent in how they're applying their request of the public. And now it makes me wonder, what was that whole 45-day extension, especially since he only allowed 4 days to go from stage 1 to stage 2?
I have to agree. I just think the inconsistencies across the state are hard to deal with. And I find too that even within medical practices in my area, some are doing, like they're really like buttoned down and doing all of these, very stringent things. And other ones are, they're not doing anything. And so it just seems like we're all over the board. And so
Right.
It's difficult to, like, especially, and I think, I don't know, I can't understand it, but then I'm trying to educate patients on it at the same time. And that is, when I'm telling them one thing and then other offices are doing different things. Well, that's not
Right.
what and I find that, I don't know, maybe we need to do a better job of communicating to people, to,
Mhm.
both to patients and to our staff. I thought this was interesting. I had gone yesterday at an eye appointment, and I left the office, and it was right here in my building. When they called me last week to confirm and said, "Do you want to keep your appointment?" And I said, "Yes, I will keep my appointment." And they said, "Well, make sure you wear a mask, and we will be asking you some screening questions when you come in."
Mhm.
Sure, not a problem. I left the office. It was in our building. I went upstairs for the appointment, and my first question that I was asked was, "Have you been out of the state in the last 14 days?" And I
Mhm.
said, "Yes, I was on vacation last week. I was in the Outer Banks." "Oh, I'm sorry, we'll have to cancel your appointment." And I thought, why did you not tell me this?
Yeah.
Like, it just seems like, I said, this was such an inefficient process you have here. It's kind of like, why wouldn't you tell me this ahead of time? And
Right.
it just was so frustrating to me. And I just think we have to do better than that. That just
Yeah,
is.
they should have told you on the phone, we're going to ask you 4 questions. Here's what they are, by the way, so
Yes.
that you could say, yes, I was out of state, and say, oh, you know what, we're going to need to cancel. What if it was a patient that had to drive 10 miles to
Well, that's
come?
the thing. And or
Right.
if I left work early, or if I had, if I had to get a sitter for a baby so I
Right.
could come in for my appointment, I would have been furious with them, because it would have been like, you could have even a call the day before to say, let me go through our screening questions.
Right.
But I just was like, I don't know. I think we're all over the board with this stuff, and there is no consistency. And I think that, you have a governor who's saying one thing, a county executive who's saying something else, a mayor who wants to jump in and make more recommendations. It's too much.
Right. I understand. I can understand the geographic influence of the pandemic. Montgomery County, for example, where we were going to have our conference,
Yes.
was an epicenter. There was somebody with one of the first patients was actually in the hospital right across the street from the Sheraton Hotel where we were going to be.
Mhm.
And so I get that an area may have to be designated to have a prolonged lockdown area or some special procedures in place. I can understand that. but I think there needs to be that consistency. So we can always say, here's the rule, but there's going to be an exception. And the exception is going to be, say, Montgomery County, because that was the epicenter. It's sort of like New York. New York State is open for the most part, with the exception of New York City, albeit they just entered stage 1. I can understand why you would designate that, but to bring it down to a level of a mayor of a city within an, you know, and all that, that's the part that I think infuriates people, because we know that county lines, here's the street, and I live on this side of the street, you live on this side of the street, I'm in this county, you're in that county, I'm open, you're closed.
Right. It's, yes.
Yeah.
Yes.
I get you. It is amazing. I did read a report this morning. I don't know if the two of you saw that Johns Hopkins has reported that there are 2 million more hospitalizations to COVID that they're tracing back to Memorial Day and the openings of Memorial Day. And if you remember, there was that whole article and news story about the Lake of the Ozarks, and they had that big the pool party that they called it, right? Okay, well, what they did, interesting enough, is there's a video where they took the GPS of the phone GPS of everybody that was in Lake of the Ozarks, and then they monitored where they went. And then they showed the areas where that GPS was located when they went back home and what the density of the population is, which was scary by itself. But now we're at the 2-week plus mark from Memorial Day, and they just came out with, it was a bulletin that I saw this morning around 9:30 that said there are now 2 million more hospitalizations, which are, they can directly link back to Memorial Day weekend or activities. And now the concern is what the numbers will look like as a result of the protests that have been going on. It's going to be very, I think that's going to add to some of the anxiety to the patients as well as employees to, you know, go back. You know, Brenda, you talked about, you had somebody, an employee that was a high risk, and absolutely, I can understand she wouldn't want to go back until, you know, this vaccination and such. But for everyone else that may not be at high risk and they start hearing these reports, you know, I wonder what the effect is going to be on them.
Well, and that's the other thing. You're trying to open your offices back up, and now you have employees who are not comfortable working, you know, and you're in a tough position, because, I mean, if you need to have them here for face-to-face visits, I mean, I'm not sure. We don't have that right now. I don't know if it's something that I have to, you know, keep in mind that may be coming. I don't know.
Yeah.
Well, more importantly, I'm going to the Outer Banks in 2 weeks, and I need to know, is that a safe beach?
Hey, it was great. I was there.
Well, I was secretly thinking to myself, should I not go back to my office for 2 weeks after?
Well, here was 2 things I wanted to bring to you when you said you had to have COVID testing because of your colonoscopy. So you're having your colonoscopy and you have this COVID testing. Do you have to quarantine for the 2 weeks, or I mean, from when you had the testing to when you went in to have the procedure done? That was my first question.
So what I found amusing is, first of all, when I got the phone call 2 days before from the doctor's office saying that the part of the procedure is that I need to, between then and the surgery, go to this. Well, I had to call back and say to ask where to go, because I was hoping I could just go inside my hospital for convenience, but I couldn't.
No.
So when they said, you know, this tent set up. So I was like, okay. And I had to call again and say, I'm sorry, what's the time that this tent's set up? So it was 7:30 in the morning till 10 at night. At any rate, what I found interesting is when I went up to it, I was pleasantly surprised they didn't have to swab the back of my throat, because that was my fear. But instead, they just put a Q-tip up each of your nostril.
Right.
And test it that way. So I asked her, I said, so when do I get to know what the results are, for curiosity? And she said, oh, well, you can check your chart. It'll be there in 3 to 5 days. And I said, 3 to 5 days. Well, it's good I came today and not waited till next week. They wouldn't have had the results from pre-surgery.
Right.
Right. We had a person here who had to have, she had a kidney stone, so she had to have lithotripsy. She had to have the COVID testing done. And she was told that once she had the testing, she needed to go into quarantine because they wanted to make sure that she was not exposed from when she had the testing to when she was having the procedure.
Okay.
Because if you think about it, you have the testing, say you have your testing on a Monday and you continue to work the rest of the week, you could be exposed again before your procedure, and it just defeats the whole purpose. If you really think about it, it's kind of a silly requirement. So that's what she did. She had to work from home because she was going to have this procedure done. So that was what my question was to you. Are you in quarantine because of that? Because how do you know you're not being exposed today?
Right now.
Or,
Yes.
know, yeah.
Mhm.
So
No,
it
but when I
seems-
did drive up, the first thing they did was they asked me for my name, they asked me for my birth date, and then they asked me if I was there for a pre-clearance for a procedure. And when I said yes, she said, okay, wait one moment, went in to get my tube with my name label on it. I guess if I would have said I was systematic, they would have treated me differently.
Well,
But
I
it
mean,
was
but
like a-
even now, even though you're just
Right.
having a procedure done, you
You're
would
amongst
be,
people.
yes, you could be negative today and exposed tomorrow.
No,
Right.
I fully understand that.
Yeah.
I don't know.
It's really interesting.
This is the inconsistency. And it's
Absolutely.
frustrating. It is very frustrating. But
No.
I can
I
tell
did
you,
tell my husband that he's going to have to sit out in the car because they
Yes.
won't let him go in.
Right.
Right.
And they'll just take my temperature and ask me the questions again.
sure, yeah.
One of the questions that I found interesting in 2 doctor appointments I went to, when you were saying about they asked you if you went on vacation, is they asked me if I've been exposed to someone who's had it. And I said, well, yes, someone that had it, but not when they were systematic, after the fact, a month after they had it. And so then they were asking me questions about that. But I always thought, I would imagine there's people that are going to be exposed to people that have had it.
Absolutely. And how do you even know?
Right.
When's that circle end? I don't know.
It
It didn't stop anything. I got in, but
Well, I probably should have said I was not on vacation. But-
Well,
no, you should have said Outer Banks. Are you aware those beaches are bare? It's great.
My nephew is scheduled to be married on July 26th up in New Jersey. That's where they live. And of course, New York and New Jersey were epicenters at the time. They're still, trying to work out whether or not there will, be the ceremony because of new restrictions on churches and halls and so forth. But my wife works, the reason I bring that up is my wife works for Johns Hopkins Pathology, albeit at an outpatient center. And initially, everything was, have you been to New York or New Jersey in the past 14 days when the pandemic was, definitely in its height? And we had to reply, no, we weren't, because we haven't been there, and that's fine. So now she just contacted the Department of Infectious Disease to say, if there's a wedding in New Jersey for our nephew, it's not like it's a friend, but it's a nephew, and we attend, will we need to be in quarantine for 14 days later? Because there is very much the linchpin into entering any facility that had the Johns Hopkins name on it. They came back and they said, as of now, that is not a requirement. So you could go to New Jersey, you could go to the wedding, you do not need to quarantine unless they start seeing a spike, et cetera, in
Right.
what's happening in those areas. So now that was a week ago. Now we jump forward to, like I said, this morning, I get this report that there's 2 million more hospitalizations for COVID due to Memorial Day weekend. And you sort of wonder, well, by the time even the end of June comes, if that holds true, we could see a spike because of the protesting that went on and nothing about the event that started it. I'm not getting political here. I'm just saying the fact that there were protests and a large congregation of people in multiple cities, and many who have traveled to and from. What will that be like at the end of June? And then how would that affect things in July? It's going to be very interesting to see. I don't have an answer yet, but it's going to be interesting. But I mean, these are the things, and I was at the table, when my wife thought of this a week ago, and go, I didn't think about that. She said, I can't be quarantined. She said, I am required to be at work. There's only 3 medical lab technologists, and she's the lead. She is considered essential regardless, of pandemic or weather. So we're on a wait and see basis to see, whether she can attend my nephew's wedding.
Yeah, it's like there's so many of these that you're hearing. It's crazy. I don't know.
It is. I hope, I've always said this, I hope that those who are in the position to make decisions, make them from a leadership standpoint. And right or wrong, if I agree with you or not, I can respect that. But as soon as you go either political or some other direction, then you've turned what was and is a national medical emergency or health emergency into something that is just put your finger up and see which way the wind's blowing today. And that's not the way you handle this. It's not good for anyone.
Yes, I totally agree. I feel like, let's just focus on what the problem is and deal with it. It's just,
right.
I don't know. So.
And again, nothing about the political side of the protesting. It's just, is there a pandemic? Is there not a pandemic? Are we relaxing the rules or are we not relaxing the rules? That's leadership. And you know what? The good and the bad, or the heat and the accolades come with that position.
Right.
But that's my view of the world. So.
Well, when you're in charge, Peter.
Well, if I was in charge.
I don't want to be in charge. I do not want to be in charge.
No, it doesn't pay to be an elected official this year. I mean, you will be damned, and you will be damned if you do, damned if you don't. But most of them are politicians. They're not leaders, to be honest. And therefore, they're not leading. They're just playing that role. And you play that role based on who's got an issue today, who's screaming the loudest, whatever it may be. And that's unfortunately not the way this should be handled. Anyway. Well, I see we're at 12:53. I appreciate the fact that the two of you stayed on the call. I know Erin is getting ready for a webinar that my team is hosting.
I was going to get on that one too.
Yes, and don't worry, it's not a Zoom call, so you can have lunch in the background. It's perfectly fine.
Well, I'm going to have to.
So I appreciate it. Brenda, stay well, stay healthy to you and to your team. And Patty, thank you for being on this call, and stay healthy as well for you and your team.
Thank you
both.